Thank you, Devin, for that forecast. And according to the CDC, though, 2024 has reported cases of pertussis increased across the United States, indicating a return to more typical trends. Here's Christina Paris joins us this morning to talk about whooping cough in our area. Thanks for joining us this morning.
Yeah, hi, good morning. I'm glad to be here.
Yeah, I'm glad you made it in. You know, we made it through. It's certainly a winter wonderland out there.
Yeah.
And it's a pleasure to see.
Yeah.
But let's get right into the brass tacks of things. What is whooping cough for folks at home?
Whooping cough is Bordetella pertussis, which is a type of bacterial infection that irritates the respiratory tract, the upper respiratory tract. So oftentimes they'll have a whooping sound with a cough, and that's why they call it whooping cough.
Makes sense.
But yes, it has gone up. So last year we had 51 cases in Wisconsin. This year we've had 2,080.
So you're saying there's a few more?
There's a few more. Yeah, absolutely.
That's quite an uptick.
Yeah. And it's quite a strong respiratory infection. In fact, they also call it like the 100-day cough because it can linger quite
We've all heard of someone with that, yeah.
And there's, but there is a vaccination for this one. Children are typically vaccinated, and they get 5 doses, starting at 2 months, 4 months, 6 months, 18 months, and then 5 years, so at their kindergarten shots.
Gotcha.
And then we should get it again around age 12, and as adults, you should get a booster of Tdap. It's different than what we give the kids. The kids have this pertussis mixed with some other stuff, but the adults get Tdap, which is tetanus, diphtheria, and pertussis, and you should get that every 10 years to help protect.
Well, fantastic. So what are some of the distinct symptoms and how's it treated?
Yeah, so because it's a bacterial infection, it's going to be treated with antibiotics. Again, viruses, no. Bacterial, yes, for antibiotics.
That is nice that there's something for that.
Correct. But it's identifying it from a viral infection that can be tricky. So you can get symptoms or be exposed. It can sometimes take 7 to 10 days before you start seeing symptoms. And during that time, you're contagious. And one of the big things is that your symptoms, you're going to have a cough, and like I said, kind of a whooping cough. And with that irritation in the airway, the whooping cough is going to be on inspiration. So you'll cough, and then you'll have this sound, and then cough. And so if you get that, then that's a big sign of whooping cough.
That's different than sort of other sort of throat issues that you may have.
Right.
Okay.
Absolutely. It's pretty distinct because it's so severe you can vomit even.
Oh, goodness.
But other symptoms, are going to be cold-like symptoms. You might have a runny, stuffy nose. You might even have a mild cough in the beginning. And later, as we extend into a couple of weeks, symptoms are going to worsen, and you're going to have more of those severe coughing attacks.
No, that is a very good thing to keep on the lookout for. So can adults get whooping cough, or is this primarily something only for children to look out for? I know we can get it with the tetanus and Tdap, but is that something we should be kind of expectant as adults? So
we can, and some of the things that we have to be careful for as adults, one, it's very contagious, so you want to make sure that you stay away from people. So if
this is something you don't want to power through and go to work for?
No. So,
gotcha.
Right, especially if somebody who you work with is diabetic or going through chemotherapy or cancer treatment or have arthritis or other autoimmune disorders. That can really agitate those things. Even in adults, you can have incontinence where you kind of pee a little because you cough so hard. You can vomit because you cough so hard. They call it, I think, like a pertussis vomit. Or pertussis emesis or something. Doesn't matter. But it can happen. Little kiddos can have seizures with pertussis. You can get a pertussis pneumonia, so it can settle into your lungs and cause a type of pneumonia. So when, if your kids are exposed, just be careful around the holidays, especially if you're going to be around grandpa. If you're pregnant, all pregnant women usually get Tdap towards the end of their pregnancy. And the reason they do that is to kind of give the baby a little boost before they can actually, because they can't get their first immunization till 2 months. So we want to protect them. And and if you're at home with littles, tiny babies, you want to be really cautious. Often they will immunize the whole family. So if one of the kids tests positive, or if mom or dad tests positive, they'll immunize, or they'll give antibiotics prophylactically to the whole family.
Makes sense. Well, thanks for taking the time this morning. I appreciate it as always to, and of course, call your doctors and nurses and any healthcare provider.
Absolutely, especially if symptoms are really severe like that. If you think your child has pertussis, contact your provider just to see what they want you to do. They might just have you monitor at home and give antibiotics. They may want to do a test like, a nasopharyngeal, one of those great ones we loved with COVID.
The ones where they poke the back of your brain, it feels like, my goodness.
And if, if children are vomiting, high fevers, things like that, or the cough just is lingering, not going away, contact your doctor.
Fantastic. Well, thanks for coming in this morning.
Absolutely.
Certainly something to be aware of, heading into the holiday seasons. We're all going to be gathering, I'm sure.
Yes.
So thanks for taking the time this morning.
Do it safely.
All right. But coming up, we have